Hello and welcome back to the Smart Start Recreational Therapy Insights YouTube channel from Smart CEUs Hub. I'm Nathan Lamaster, your host, and today we are on episode 20, y'all, and we're going to be talking about animal-assisted interventions. So whether you have already had animal-assisted therapy in your practice or you are looking to provide this in your practice, this is the show for you, y'all. And we will be talking about everything. So we'll be talking about what you need to know beforehand, as well as how to provide the interventions for your clients. So, and let me start out by saying you don't just need a dog for this. You can do animal-assisted therapy with all types of things, like a horse, guinea pig, a cat. All these things can provide joy, connection, and powerful therapeutic outcomes for your clients. So if you ever wondered, can petting a dog really be pet therapy? We will be talking about that today. Without further ado, let's jump right on in. So the first question we're going to answer today is, what are animal-assisted interventions? So animal-assisted interventions, AAIs, so animal-assisted interventions, refer to intentional therapeutic interactions between clients and trained animals as part of a treatment plan. So there are a few different types that you should be aware of. One is animal-assisted therapy, which is AAT, goal-directed, delivered by a professional, integrated into treatment. There's animal-assisted activities, which is AAA, more casual, like friendly visits from therapy animals, and service animals, not recreational therapy per se, but worth understanding because animal-assisted service animals are there to assist with medical needs, and some of your clients might benefit from these. So, animal-assisted interventions are more than cute encounters, so they shouldn't just be there to make people smile, but there should be some sort of goal attached to them. They are structured, they're goal-oriented experiences. Okay, so let's talk about some benefits of this type of intervention. So let's talk about the science. Let's talk about interacting with therapeutic animals and how that can integrate into the therapeutic process that you have at your hospital or community center, depending on how you are doing this. So some things that you could be working towards could be reducing blood pressure and heart rate, lowering cortisol, which is the stress hormone, increasing oxytocin, which is the bonding hormone, promoting social interactions, and encouraging physical activity, especially with equine-assisted therapy programs. So we'll talk about that as well. And for clients struggling with isolation, emotional regulation, trauma, or mobility challenges even, animals can be a bridge to healing. Okay, now we're going to talk about some various animals and their uses for therapeutic recreation interventions. So let's start with dogs, because that is the most common type you might see in your practice. They serve a very different purpose depending on what type of animal you're using and what your goals are. So dogs are great for reducing anxiety. So you might see support animals that are being used for individuals who struggle with anxiety. They might have even like a license to use them, for instance, like in an airplane. Like let's say they're ready to go on a trip and they're anxious about flying. It could be social or anxiety, or various types of anxiety that the dog actually will assist with. They're often used in hospitals, schools, and rehab settings, and they can help build rapport and comfort with your clients. So if you're going to use therapeutic animals, and you choose to use a dog, these are some of the goals that you might work with your clients with. So horses, which would be called equine therapy, can help even promote balance. They can be motor planning, emotional regulation, often used for trauma recovery and behavioral health. So with a horse, for instance, you can ride a horse. You can't ride a dog per se. You might be doing this in a different type of setting, not in a hospital, but in an equine therapy setting. And the goal might be to work with kids with autism, for instance, or people who have some sort of anxiety, or let's say it is cerebral palsy or some sort of physical rehab that you're trying to do with the client. Riding a horse requires certain muscles to be activated during the ride. That could be your core muscles, that could be your thighs, your legs, it could be your hands, maintaining the reins of the horse. And these are things that you can use when you think about it for your equine therapy practice. You can even use small animals, so like rabbits, guinea pigs, things like that. They could be great for kids. Small animals typically are less scary for children than larger animals are. I can tell you about my daughter, for instance. My daughter and my wife and I, we went on a cruise recently, and we went on an excursion in the Grand Cayman Islands, and one of the excursions was a twofold. It was a working with stingrays and also with sea turtles. So in this instance, we were in this really beautiful water. It was amazing. But these stingrays were all gathered around, and my daughter was terrified. I mean, I had some anxiety myself, and let me just tell you that being in that environment was an experience. Let's just say that. It was an experience, but my daughter would not touch or pet any type of stingray that was large. So it wasn't until we got a baby stingray, so a stingray that was, so small, about this size, and the person that was leading the excursion was able to grab it, that my daughter felt comfortable interacting with the stingray. And it was hilarious because the stingray because the stingray's mouths are below the animal, when the guide lifted it up, the mouth showed, and the mouth just squirted water at her. It was hilarious. So, not saying that stingrays are the preferred animal for animal-assisted therapy, but the idea of it being a smaller type animal is usually less threatening for kids. So they also can work for older adults or indoor programs that you have, depending on if it's like a hamster, guinea pig, lizard, something of that sort. And it might encourage nurturing and sensory regulation. So the goal of the therapy that you use that type of animal for will be different than taking it around to on an airplane or those types of things. But this might be something that they have in their homes or in the hospital that can kind of help them to come back to center, where they are no longer stressed or anxious about something. For me, I love hamsters. Whenever I get a chance to go to PetSmart or any of those places, I, still to this day, almost 40 years old, I will stop by the hamster cages and just stare at them. It brings back good memories. It brings back calmness. And I just love watching those little things. So that what works for me. A lot of your clients, they might be into hamsters, lizards, snakes, dogs, cats, whatever. You got to figure out what they like during your assessment that you do with them. Another one that is a lot of times overlooked is fish. So yes, even fish can be used therapeutically. So aquariums have been shown to reduce heart rate and promote calmness. So somebody's having a panic attack, it could be staring at this aquarium that you guys have set up with various types of fish that could actually produce an effect of calmness. It can be used in memory care units and waiting rooms. If you want to bring people to a certain state of mind in those types of settings, fish actually can be a great use. So let's say you work in a hospital or long-term care setting. You might even talk about having an aquarium that people can stop by whenever they would like to go view the fish and just kind of see what they're doing. That could be a great therapeutic use tool. So now we're going to talk about tips for integrating animal-assisted interventions into RT practice specifically. Okay, so if you're interested in bringing these types of interventions to your setting, here's what you need to keep in mind. You need to partner with a certified therapeutic animal team. Don't just bring your own pet. The animals that come to your facility or to wherever you're wanting to do this type of therapy, they're highly trained, and there are trainers that are usually with them, and that is the best use. If you bring your own animal, there's no, I mean, there could be rules against that at your facility, for instance, but also the animal might not be behaving in the appropriate way to achieve the therapeutic goals that you are trying to achieve with your clients. So that is something really important to take in consideration. Ensure the animals are properly screened and trained. There's organizations like PATH, for instance, and various others where they work with equine therapy, or you can even do with, dogs, for instance. But there are organizations that specifically train dogs for being service animals or therapeutic use animals. You need to check with your facility policies. So some require vaccination records, some might require behavioral screenings or handler insurance, those types of things. So you want to make sure that you ask those questions to the provider in conjunction with your administrator that is at the facility, because they may not let you have this type of program if you don't have these things already in place. You also need to consider allergies. So clients might have allergies to certain type of pets, phobias, so fears of different animals, cultural preferences. Some cultures look at dogs differently than Americans typically look at them. Some, for instance, like in Mexico, they don't look at dogs as pets; they look at them as pests. So their view of a dog might be very different than what you are viewing the dog as a pet. And then always have clear goals that you discuss with the client. And then for the interventions that you use, and don't let the cuteness be the only thing that you are trying to do. The cuteness of the animal, yes, it will produce a few smiles and people petting them, but really focus on what you're trying to do with the client, and why that specific client should use an animal in their therapeutic process. So really think about that. If you can't bring live animals into your facility or into your community center, some things that you can consider are virtual pet visits or videos. So sometimes just watching the old school YouTube and seeing various pets interact with people, do funny things, cute things, etc. Those pets actually can produce a sense of calmness, even though they're not actually there. Robotic therapy, so like you might have a robotic dog or robotic cat that can be used in the therapeutic process. There are companies that specifically make these types of animals. This could actually really work for your dementia clients if you work in a long-term care center. Let's say that they used to have a dog or they used to have a cat, and taking care of this dog or this cat brings them to a state of calm and a sense of control. Might lower their anxiety levels, those types of things. But you don't want to have like the allergies that come with those types of things, the potential dangers or other things. Dogs and cats that are robotic can actually be a really cool addition to what you provide. Animal assisted storytelling or crafts. So you can actually have the dog come in and kind of give the whole background of the animal, for instance. And maybe it was abused previously, maybe it only has 3 legs, maybe whatever the thing might be, and use that to connect with clients. I'm not saying that you should only do storytelling when it has to do with like a story of trauma, but sometimes the story of trauma is what connects clients to the animal. So that is something to consider. All right, now we're going to talk about some wrap-ups and takeaways from today. Let's recap some of the things we discussed. Animal-assisted interventions are more than just petting a dog. They're structured and goal-oriented. Animals can support emotional, physical, cognitive, and social goals. So depending on what the goals are for the client, you can tailor the animal therapy to address those goals. And with proper partnerships and planning, you can bring animal based interventions to almost any RT setting that you are in, depending on what the protocols are for your facility or the place that you work. Really discuss that with the administrators and like the people that are above you, just to see if this is something that you can bring to your practice there. It is a great addition. And thanks for joining me so much for week number 20 as we discussed animal assisted interventions and various ideas that you can use for your facility. And if you want to drop a comment below, that'd be really great. Telling me about maybe some animal assisted interventions that you use in your practice that could also be used when people read these comments, can be applied to their settings, whether or not you've had actual success using this type of therapy. That is a great resource that you can provide just by giving your own stories in the comment section below. So next week, we're going to be talking about, in episode 21, we'll be talking about leisure education and advocacy. So this is another area of recreational therapy that we do. Besides providing, the interventions, we also do leisure education for clients that may have never ever experienced something or need to learn how to adapt it. We'll be talking about that. And then advocacy efforts, because a lot of times, let's say we work with people with various disabilities, they might need a voice to represent them to getting bills passed or various other things that we can do for advocacy to make sure that their lives are as great as possible and that we are being the best recreational therapists that we can be. All right, so without any further ado, I'm going to end this episode for this week. I hope you had a great Monday, and I hope you are going to have a great week ahead of you. Please reach out to Nathan at Smart CEUs Hub if you have any questions. I am enjoying doing these episodes. We are, on our way. This was episode 20. We're on our way to episode 21. Our goal was to do 52 episodes this year, so we're right on track. So please like this video if you find it helpful. Subscribe to the channel so you can get these videos in your inbox every single week. And without any further ado, and as always, recreational therapists, please stay classy.